Hello again, everybody. Today is Tuesday, and it is noon, and you are listening to The Wellness Connection. And my name is Dr. Frank Gomez. I'm a chiropractic physician, and for you people who can see me on Facebook, I'm waving. I've been a chiropractor now for 32 years. As a matter of fact, April is my 32nd quote-unquote anniversary as a chiropractor. So I thought today would be a great way to kick that off by speaking about something that is actually the staple to chiropractic profession, and that is lower back pain. 85% of the American population has lower back pain at one time or another. 50% of those turn into chronic lower back pain, and then 25% of those have disabling lower back pain. So it is definitely something that we as humans have to deal with almost on a regular basis. You know, one of the reasons, believe it or not, is because we walk upright. And nowadays, we're not like we were when we were back in the caveman days, and we were always active, moving around, climbing mountains, rocks, walking on uneven surfaces, and actually keeping our core very strong just by doing the activities that we needed to do every day. In these modern times, all we do basically is sit down. And we sit in boxes, right? Like I'm doing right now, right? We get up in the morning, and we sit at the kitchen table, we have breakfast from a box. And then we get up and we do our thing, we get into the car and we drive to work in a box. And then we get to our office and we sit down in a box for the most part. And that alone causes weakness in our core muscles and causes the pain. And we have to then deal with it in some kind of manner, which there are many ways to do that, and we'll talk about that. And another way that our body breaks down is just from overuse as we get older. And depending on what your actual vocation is and what kind of job you have, that can also cause lower back pain. I have many patients in the construction field that have been, they're plumbers, electricians, masonry workers, and that has caused them to wear and tear over the years and break down. You know, your body can only take so much before it starts to break down, produce arthritic changes. And I get them in the office, and sometimes it's a quick fix. A few adjustments, and they feel better, and, then they're on their way. And they'll stop in every once in a while for what I like to call a tune-up, or whenever the pain is to the point where they need to take care of it. And unfortunately, sometimes people will come in and they've had this problem for many, many years, and it does take quite a bit of time to get them well again, even at the rate of 3 times a week, which we usually do as chiropractors, have people come in the beginning. Just like anything else, you have to be very consistent. You have to do the things that you're supposed to be doing at home, and then the results are a positive outlook. So let's talk about the spine a little bit. I do have a model here, and I apologize for those of you on the radio that you're not going to be able to see this. But, you can always pull it up on the computer and Google spine and anatomy and that kind of thing and kind of see what's going on. So right now, I am holding up a spine. And since we're talking about the lower back, it's these last 5 vertebrae in the spine here that make up your lower back. And these vertebrae protect the spinal cord, which runs down into the middle, and then these are the nerves that come out. Nerves. All right, and then these is your pelvic bones, and this is actually your tailbone, because a lot of people talk about tailbone. All right. And then what we have is these nerves come together, and they form what's called a sciatic nerve. And a lot of people have sciatic pain. Well, what is sciatic pain? Pain is pain that's constantly in your legs, right? And it runs from your back all the way to your feet many times. And the sciatic nerve is the largest nerve in your body. But we're going to be getting into sciatic next week. So if you want to hear more about it, next Tuesday, 12 o'clock, tune in, and we'll go over the sciatic problems. So, and then we have here our discs in the lower back. Now the discs, you've heard of slip discs before, right? But the actual function of a disc is to keep the spaces between the vertebra so that your nerves have enough room to move around and do what it's supposed to do without being pinched off. Many of us have had pinched nerves, and you know how painful that could be, especially in your lower back, because it can be debilitating, and you can last for days, and you can be laying in bed. So, and also they are tiny shock absorbers. So when you're walking around, the bones aren't banging off of each other, and then they create mobility, side to side, front and back. That helps some of the mobility. And speaking of mobility, in the back here, in the back are the joints. And I apologize again for the radio, but I'll go through this pretty quickly. And the joints help for mobility as well, right? Low back goes front and back, and as we move up the spine, it turns into more of a side-to-side thing. And then when you're up into your neck, there's a whole lot of motion in your neck because, we need to turn our heads. Sometimes, look behind us, especially if we're driving or if we have little kids. We're always looking around, seeing where they are. So that's basically Spine 101. I will say that the nerves in the lower back are, every nerve in your body controls something. So if you have a pinched nerve, it doesn't have to be a terrible nerve, pain, you're still going to have an issue with whatever it is connected to. So in the lower back, again, it could be your legs, it could be your lower abdominal area, it could be your sex organs. Anything that is there can cause you to have some pain and dysfunction in those areas. Under extreme cases, you can have loss of function of your bowels and whatnot, and then that's usually an indication of something severe, and that might require surgery. And speaking of surgery, there are a lot of low back surgeries here in the United States, and unfortunately, most of those surgeries are really unnecessary surgeries. Unnecessary means that the person had gone to another doctor, let's say orthopedic for just to say, and the orthopedic decided, well, this is pretty bad, let's do surgery, and the person never did look into doing something alternatively, which is a non-invasive procedure at first, like physical therapy, acupuncture, massage therapy, and of course chiropractic care, or a combination of either. People also look for quick fixes, when it comes to our ailments that we have. And usually, unless it's a trauma, we've had these issues for a long time. It does take a while for them to get better. So even when you go to acupuncture, it's frequent, at least once a week. You go to physical therapy, 2-3 times a week. Massage therapy at least once a week, and you go to chiropractor up to 3 times a week as well, to build up that consistency and to get the bodies to start to heal again. So the phases are: one is an acute phase in which we have to put the fire out. There's a lot of acute people out there, not cute, acute, and in pain, inflammation, and that can be handled in many ways. If I have a patient who comes in and they're in a really acute situation, I can't really do anything, and even touching the person will cause them to have some increased pain, and so at that point I would recommend, I have many medical doctors that I do work with and refer out to, and it would be their job to put the fire out, get them to the point where I can actually do some work. And they have many different ways, to handle that. Sometimes the acuteness isn't quite as bad as that, so I don't need to refer them. There's many ways that you can take care of this at home. There's supplements that you could take. One of the best ones that I have found over the years is from DC Labs, DEECEE. It's called Formula 303s. Some doctors do sell them in their offices. We have some in our office, and you can actually go online under dclabs.com probably and pick them up yourself. And depending on the level of pain and inflammation that you have will determine the amount of servings that you need to take in a day. Sometimes it can be up to 3 times as much as it's recommended on the back of the bottles, because what's put there is minimal, and it's made to be changed by the doctor, who has supplied them to you. So if you have them and you did get them on your own, you might want to discuss that with your doctor, whether it be MD, chiropractor, or physical therapist, or whatever, and discuss what kind of levels would be good for you. And then there are a lot of things also that you could take, other supplements like curcumin and turmeric. Those are very good for anti-inflammatory, getting rid of inflammation in the body, especially at the injured sites. Vitamin B6, vitamin C, vitamin D3, any one of those or a combination of would be an excellent source of natural way to handle an acute situation, as long as it was not terribly bad. And foods that we eat also cause inflammation. Basically, every problem that we have in our bodies is caused by inflammation. And that's another thing that we do in our office. We have a wellness office here in Sayville, and actually the address is 4844 Sunrise Highway in Sayville. And when people come in with different things, it could range from let's just say autoimmune problems. There's so many that, Crohn's disease, colitis, any kind of autoimmune disease. A lot of that is caused by the initial buildup of inflammation in the body, and it attacks certain parts of our bodies. And so we try to help people that way. What we do is we take an extensive blood work, and we'll find out where the body's deficient, and then we fill those deficiencies with some custom diets and vitamins and that sort of thing. So just to get back to what we're doing, oh yeah, by the way, Facebook, if you like, leave a comment on the bottom, push the like button, and I will be happy to get back to you with any questions that you do have. So we got back, I kind of lost my train of thought, but we were talking about inflammation. So one of the worst things that you can eat, let's talk about foods, is sugar. And sugar comes in many different forms. A lot of these protein bars that you eat, you would think they would be healthy, but they're really not. They have loaded with sugar and other preservatives and that sort of thing. So it's very important that you read these labels. You'll see something that says, oh, we have 2 grams of sugar. Now, if you ever had a protein bar that only has 2 grams of sugar, that's a really good start. But then it says, sugar alcohol, and 20 grams of sugar alcohol. Okay, what is sugar alcohol? Sugar alcohol is sugar. It's just a manufacturer thing to throw you offline a little bit. So you got to watch that as well. A lot of the cereals these days have high in sugar, and obviously processed foods, cookies, and my favorite thing and my kryptonite, I guess you'd like to say, is ice cream. I can literally probably down, and I used to do that when I was younger, sit down and eat and get a half a gallon of ice cream and a spoon and sit down and watch a football game with my dad, and we would go to town with that, and before you know it, half the gallon was gone, And you can probably get away with things like that every once in a while when you're younger, but as we get older, we have to be very, very careful about what we put in our bodies, because our guts aren't as strong as it was, and digesting food becomes an issue. And then again, the digestion thing, we help a lot of people with that as well, doing the same exact process of blood work and finding deficiencies. So there are a lot of studies that you can actually find and I didn't bring any with me, but it's just so easy. They're just so abundant. You can go onto Google, and you can Google chiropractic and lower back pain, and you could see how many studies have been done to show the importance and the effectiveness of how chiropractic is for lower backs and the pain that is produced in our lower back by coming to the office and getting adjusted. So I say adjustments, and I say it regularly, and some people are like, what the heck is an adjustment? Well, a lot of people that come into the office, they call it, you're cracking my back, And, it's funny because years ago, I used to, fight that. And I'm like, no, it's not cracking your back, or we're adjusting it. It's a fine-tune cracking, quote unquote. It's like, when you have your TV or your radio and you're tuning it into the right station and you're trying to find a good reception. That's what we do as chiropractors. We're fine-tuning your back. We're moving the bones where they hopefully need to be, and your body's going to put them there, and take the pressure off the nerve, because once a bone moves out of place, and it only has to move millimeters to put pressure enough on the nerves to decrease the function of those nerves by 40%. That's a huge number. And again, unfortunately, some of the nerves in our backs connect to our organs. I mean, not unfortunately, but it's unfortunate if you have a pinched nerve and it goes to your heart and it decreases the function of your heart by 40% over the years. That can cause a huge problem and be detrimental. I know this is a little offline, but I remember when I was in practice just for the first few years, I had a patient come in and we did an x-ray on the middle of his back, and I saw how his lower back was totally twisted up. So if this is a straight, again, I apologize to the radio people, but if your spine is straight, it was totally turned and twisted. And he had a lot of pressure in his mid-back. Got a little stuck here. He got a lot of pressure on his mid-back, and I told him, I said, these are the nerves that go to your heart, and it can cause you to have some problems. I don't know. He didn't have any heart issues at the time, and he told me I was a quack. He goes, I heard of you quackers. He goes, he goes, I'm not coming back here. My back has nothing to do with my heart. Well, unfortunately, about a month passes, and the man dies of a heart attack. How did I know? Well, his wife called me, because I'm sure he must have went home, and he said to his wife, I went to that chiropractor, and he told me that my heart wasn't going to be functioning because my back was hurting. And that's an unfortunate thing. Now, I could have worked on him, and it's probably, maybe it wouldn't have mattered, but maybe it would have. Who knows? Only God knows what would have happened in that. But anyway, that's just a story about how our nervous system connects to our organs, and if it's compromised, we can get anything. So back to the lower back, and I forgot where it was again, and I do kind of do that. I kind of go off tangents, and it's craziness. But again, if you have any comments on Facebook, just leave them below, and I'm sure I'll get to them. And anybody on the radio, you want to do the same thing, because this will be posted on my Facebook site, which is Total Health Wellness Center. So you can just go into the browser on Facebook and put in Total Health Wellness Center and find this, and you'll be able to leave a comment on the bottom. So let's go over some more things that cause a lower back pain. Again, we talked about wear and tear. We talked about the construction workers, and a lot of people who sit. And I'm sure you've heard stories, right? You bend over to tie your shoelace, and then you can't get up. Your back has gone out. And I myself have issues like that every once in a while. Back in the 80s, I was a big-time bodybuilder, national level bodybuilder, power lifter, abused my body, heavyweight, and all that kind of thing. And I do try to help people that are younger now, but they don't want to listen. And I wouldn't have listened back then either. I had to fix my phone. Sneezing and coughing. That throws your back out, right? Especially if you have a weakness. when you sneeze and you cough, you can expel air out of your system and out of your lungs up to about 100 miles an hour. That's pretty damn fast. And that causes a lot of pressure, can throw your back out as well. So what happens is after you have some pain for a while, right, you can take some ibuprofen at home and nothing seems to be working, and it's like, well, I've heard that, go to a chiropractor, or I have friends who went to a chiropractor, and you come in the office and, so what's the procedure? You go into the chiropractic office, and like any other doctor, you're greeted by the receptionist, you have some insurance and paperwork to fill out, which is pretty extensive sometimes depending on the insurance you have. And that's a whole another story, insurance. You pay for this insurance, and half the time it doesn't cover what you need. But that's, like I said, that's a political thing, and I don't get into politics. So then you come into the office, and we sit down, we talk, we do a consultation, ask you certain questions, and you can respond, and then kind of lead you towards what's causing the problem, and how long you've had it, how do you describe the pain, what can you do, what can't you do. And then once we get through that, we do an examination. You all come in, we'll sit, and I'll have you move around, bend over, bend back, or whatever, and have you walk on your toes, I'll walk on your heels, and we'll lay on your table, and we'll do some what they call palpating, which is actually feeling on your back. And through the feedback I get from feeling on your back, I can tell muscle tone, spasms, inflammation that you may have in the joints. And we check for range of motion. And range of motion is the mobility of your spine. Again, this is your pelvis down at the bottom. And, we all have sacroiliac joints. I don't know if you ever heard. I know my grandmother used to say, oh, my sacroiliac. And I'd be like, what the heck is a sacroiliac? Well, that's where your pelvic bone meets your tailbone. And this creates a celiac. It creates a sacroiliac joint, which is the largest joint in your body. And up to 40% of the problems in low back actually aren't low back bones. They're coming from your pelvis. And it takes a trained, chiropractor, physical therapist, or whoever to actually figure out the difference. And once we figure out the difference, we have to figure out, exactly what we're going to do, because everybody's different. And to get the bones moving, to get the proper diet and foods that you have to eat. And, if you need rest, sometimes you got to rest. Sometimes you got to take off for work. And, if you need a back brace, then you need a back brace. But, when you're in pain and you have an issue or a condition, it has to be treated. It doesn't matter what the condition is. And you can have heart problem, lung problem, kidney problem, and, you go into the medical doctor for certain things. You still have to be treated. And if you have to take off from work, unfortunately, you have to take off from work. Being sick is it's not fun, and for me, having back pain, neck pain, or whatever is just like being sick. We need to take care of it in a specific way. So that's basically it in a nutshell. Again, anybody on Facebook, leave comments. If you're on the radio, Total Health Wellness Center on Facebook, and leave a comment, and I will definitely get back to you. And again, I'll be back next week. Next week we're going to be doing a little spin-off of the low back pain, sciatic pain, and then we get a lot of patients in with sciatic pain, certain things that can be done for that. So, let me give you my office number. Again, my address is 4844 Sunrise Highway in Sayville. Our phone number is 631-991-3492. And if you do happen to call and you do need to come in, just mention you heard about us on this here radio or Facebook, and we will extend you a free consultation. So it doesn't cost you anything. You can show up, and we can talk about what's going on with your situation. If I can help you, I'll tell you that. And if we can't, I'll tell you that too, and maybe where you can go. So with that, I'm going to sign off, and I really appreciate you tuning in. So, yeah, I went through the basics, so we're okay. So, again, I'm going to sign off, and Circle of Life is going to come on in for a few minutes. That's one of my favorite songs, and very spiritual for me. And that's it, folks. Thanks for tuning in, and we'll talk to you next week.